disease control and prevention. The stage is yours, Dr.Lei. So,
Okay, thank you, Ali. Everyone, thank you. Hello, and on behalf of the Professor Dong Xiaoping, my colleague, I will introduce briefly with the China's updates of the COVID-19 and to share our experience and the lesson learned from this outbreak so far. So later, after the presentation, I think Professor Dong and me, we will both be available for the Q&A. So, okay, this is the epi curve, the timeline of the epidemic and the response to the COVID-19 in China since the end of the last year in December. So this figure, I think, must be very famous to everyone because the Bruce, the team lead of the China WHO Joint Mission, already showed this figure to the interview conference at the end of the February. You can see from this figure that in China we are stopping the epidemic in the country. So if we looking at the tailor of this curve, actually in China now the domestic number of the cases is quite low comparing with the previously epidemic peak. So now we are on the stage of the lift of our strategy and measures. I will be introduce the more details in the later slides. So as the previous speakers introducing that in China, we detected and confirmed the COVID-19 etiology, the virus, the novel virus, very early the just the occurrence of this emerging infection disease. And we shared our findings as well as the sequencing with the international community, also including the publication on the journals. So this figure shows the epidemic curve of the COVID-19 in China by using the date of the onset and the date of the report. You can see from this figure that it's actually there is a lag of the onset and the report. That due to some factors such as the behavior of the medical seeking of the population in China, and of course there's another factors of influencing this, like such as the earlier the timeliness of the reporting and the identification of the cases. I would like to ask you to look at the yellow square. So according to the figure, we think the peak of the epidemic may be associated with the exposure duration, as the yellow square showing. So this figure shows the geographic distribution of the COVID-19 cases in China. I showed a map of China so that for the audience might not be very familiar with our country geographic distribution of the different provinces. As you can see, in the middle of the China, that is the very famous epicenter in China, that's in Hubei province. And I'm working in China CDC, located in the Beijing, the capital city of China. So on the right side of this map, it is the current situation in China as of the yesterday. So for the whole country, we are now have more than 80, we have around 82,000 cases. That's almost recovering now. And we also have more than 3,000 deaths. It's resulting true case fatality ratio to around 4%. But however, in the epicenter of the China, like Hubei province, it's totally different with the whole country. You can see the two box under the whole country. That in Hubei, the case fatality ratio is really higher than the other provinces, excluding Hubei in China. So in the other provinces, the case fatality ratio is quite low. It's no more than 1%. So this is the age distribution, because for this emerging infection disease like COVID-19, it's really different with the other emerging infection disease we can see from previously epidemic like SARS or the avian flu or pandemic H1N1. So for this disease, for all the confirmed cases, we found that most of the cases is in the age group between the 30 to the 70. However, for the death, you can see the age really increasing. So that causing the elderly people might be more critical than the other age groups. So as I mentioned before, in the timeline curve, I mentioned our the China is now in the different situation. So we are facing the importation threat from the other countries. So the first imported case actually occurred in the end of the January, but by the March 25th, it's already have the more than 500 imported cases. It's from the 54 countries. I'm sure the number is increasing since the March 25th. And most of the imported cases are from the Europe and the UK, and as well as some countries like Philippines in the Asia. So most of the imported cases are very milder and moderate. So the asymptomatic imported cases also have the more than 18% proportion in the all imported cases. So you can see the three figure and lights regarding the imported cases now. There's seems like no difference between the different gender for the imported cases, and the age group is most of the imported cases younger people. It's not like the confirmed cases. Distribution of the age in the China for the domestic infections. So according to the Chinese experience before, we conclude some findings regarding this COVID-19 as well as the virus features. So firstly is the transmission dynamics. We found that most of the cases is really were detected and confirmed from the close contacts. We think it's because of our control measures. We are really focusing on the early detection and early identification, especially focusing on the close contact management. So that's make us can be find the cases from the close contacts, and the proportion of the case detection among the close contacts is around 1 to 5%. That is the number from 3 different regions in China. It's from the more than 38,000 people's observations. And according to our observations, we think most of the cases in China is really coming from the family clustering cases. So we think the transmission was mainly driven by the family transmission. And so we are monitoring the secondary household attack rates, especially from the family clustering cases analysis. It's about 10% early transmission, the attack rate from the family clustering. And however, later, this proportion really declined, and it's declining to around 3% because of the control measures like rapid and early isolation for the close contacts. So that's really helped. But we also observed some outbreaks occurring in the other special closed settings like health facilities, nursing homes, even in the prisons. But it's seldom detected and observed in the schools, because during the peak, during the transmission of the spreading, we close the schools as early as we can, so the transmission in the schools was not observed so far. So next is the clinical and the epidemiology observation findings. So regarding the diagnosis, we think, as my colleague from the Dr. Lee just mentioned, most of the cases are very mild and moderate at the time of the diagnosis or detection. But actually, we really found the disease is progressing later. So about 10 to 15% of the mild or moderate cases at the time of the detection is really became the severe or even critical. So things is changing. We need to provide early treatment for them, even with the mild and the moderate symptoms at the time of the diagnosis. And for the intervals, that is a very important duration. We need to pay more attention. Like we really found the duration from the exposure to the symptoms onset is around 1 week. And from the symptom onset to recovery for the mild cases really shorter than the severe cases. And from the symptom onset to death is around 2 to 8 weeks. Another issue is a symptomatic infection. It's really famous currently and discussed all over the world. So actually in China, we think it's not so high proportion of the symptomatic infection. Of course, at the time of the detection of cases or diagnosis, some of them, especially from the close contacts, is classified and identified as a symptomatic infection. Actually, it's not a true symptomatic infection so far, indeed, because later, most of the, it's around 75% of these such so-called asymptomatic cases soon progressed to disease with milder or even severe symptoms. So we think maybe this percentage is less than 1% in China through our molecular testing for the cases. And we also concluded that this symptomatic infection may not be the major driver for the transmission in China. And for the children infection in China, we really found this a number of the children infections among the all confirmed cases. However, the children cases usually tend to have a milder disease than the adults. And most of them is being identified through the contact tracing in the households of the adults also. So regarding the virus shedding, we are keeping monitoring the virus mutation and shedding features. So it's really high at the early of the course of the disease. It's totally not. It's totally different with the SARS virus in the 2003. And we observed that the virus shedding peak is at least 5 days after the onset. And also, we also observed the virus shedding can occur ahead of the symptom onset. It's also different with the SARS virus in 2003. And we also isolated the virus from the stool to indicating it might be some likelihood of the fecal oral transmission. However, we are still studying on this issue, and we need more evidence to confirm this transmission route. And the viral shedding usually continues for 7 to 12 days in the mild and moderate cases, but in the severe cases, this duration is really longer than that. And also, everyone maybe noticed that the patients who recovered and discharged from the hospitals maybe still can be tested positive by the RT-PCR testing assay even after symptoms resolve. And this feature is still under study and further investigation. So regarding the mode of the transmission, we think the major routes were the respiratory droplets and the close contacts. But still, there's a possibility of the aerosol transmission, but in the relatively close settings and with a prolonged exposure and a large dosage of the virus. And indirect contact, like long distance aerosol transmission due to stool, contaminated environment, got some likely. And we study the transmissibility of the virus and get a number of the basic reproductive index.
3 minutes. You have
Sorry?
3 minutes more.
Okay.
3 minutes.
Oh, sorry. I will go through quickly. So now go to the control, the strategy and the measures. So the major pillars of the containment strategy in China focus on these 7 pillars. I will not go to the details. And this all through the whole epidemic control in China. So in January, our measures focus on the 5 pillars, like the universal population measures, case isolation management, close contact quarantine, and suspension of public health and restrictions. You can see from the results. So the contact management is very, very important for us. That means we provided the 14 days quarantine to the close contacts and gave them twice per day of the temperature and symptoms monitoring and action not going out. And for the mask wearing, we think this is also very important for us. It's a key issue to control and stop the transmission. It's not only protect yourself and also protect the others. So please wearing the mask based on the risk assessment for the different specific populations. And in China, we develop it, and our protocols on the disease control and prevention according to our scientific evidence or the observation from the control and the prevention for the disease. So now we are making the revision for the 6th version of control protocols. So we continuously emphasize the 4 early strategies. I would like to mention again, that is early detection, early reporting, early isolation, and early treatment. It's very, very important again. So we are also amending our technical guideline as well as the serologic diagnosis assay is developed. And we focus on the imported patients. That means we try to prevent the importation overseas in the later response, and we strengthen our technical support to our government to make the scientific and the right strategies. We lift and adjust our strategy and the measures based on our findings, and we also utilize our Chinese medicine in treatment, as the Dr. Lei mentioned before. That on this slide in the bottom, it showed our website linkage of the protocol versions. If you need it, please go to that website.